Another fun fact is that the effect of dairy and ice cream, because a lot of people will say, oh my gosh, every time I have that, it makes me cough. What happens is dairy products like milk and ice cream can make the mucus feel thicker and stickier, although they don't really increase mucus production at all. The last one is amount. So we went color, odor, texture, and now we're on amount. So you want a normal production. Small amounts are absolutely normal because that's your way of your lungs to clear themselves. So we want that. Excessive amounts, that can suggest that something's going on. It could be a pulmonary condition like bronchitis or COPD, or even an infection. The good news is you get all that information, you share this with your doctor, and they might do some tests. Because if they're going to evaluate it, they're going to take your sputum, you'll spit it into a little cup, and then they're going to look for any pathogens like bacteria or virus or any fungal infections, anything like that. And they're also going to assess the cells that are in there, whether they're inflammatory or any cancerous cells or anything like that. So they're going to look at that. They're also going to monitor your chronic conditions like COPD or bronchiectasis or even cystic fibrosis. They're going to use all that together to set a really good treatment plan. So they may either do a sputum culture, which is really simply they'll give you a little cup and you'll spit into it and they're going to analyze it. And then they can also, like I said, they can do some cytology where they'll look at it a little closer and they'll look for abnormal or cancerous cells. So right now you're probably saying, okay, you have all this information you've given me. You scared the heck out of me with some of it. When do I call my doctor? So a couple of things that I want you to think of. First of all, if you have any concerns, always call your doctor. But some of the ones that I really want you to think about, because if you do call them, it will be helpful if you can, like I said, discuss the color, the odor, the texture, amount. And if anything like that changes, that's when you want to call them. Another one is if you have blood in your phlegm or sputum, because that's something that they would want to know about. Or if it continues and it's persistent or it worsens, that's something that's going to let them know that something is going on. Other symptoms could include fever or chest pain or difficulty breathing or wheezing, or if you're noticing that your pulse ox is really starting to drop below 92, we don't want that.